Hi, I'm Dr. Brian Humphreys. I'm here today to tell you about serous otitis media, which is the fancy word for ear fluid and ear infections. If your child or you have been diagnosed with otitis media, you're probably wondering, well, what does this mean? Do I have a permanent hearing loss? Can this be fixed? How do I recover? I'm here to answer some of those questions today. Serous otitis media, or ear fluid, is probably one of the most common diagnoses in children in the United States today. There are several treatments for serous otitis media. The fluid collects because the ear in the middle ear space normally produces ear tears, as I call them. However, they normally are brought out by the eustachian tube, which is a tiny duct on the inside of the ear that evacuates the fluid. Just like tears in the eyes, if the little tiny duct is overwhelmed, the fluid collects. In the eye, it produces tears. In the ear, it produces fluid. This ear fluid causes several problems. Number one, it instantly reduces the ear's ability to hear properly. Number two, it is a setup for an ear infection. Number three is that hearing loss, particularly in young children, is also important for that child's language ability and proper language development. New studies have indicated that a child who is not hearing properly does not develop proper brain center growth. As a consequence, the language skills of that child are behind. Studies have shown that the language skills are always behind. They're behind in second grade, they're behind in 10th grade, they're behind in college. Unless we correct that problem early, those delays in language ability can be lifelong and permanent. That's the real reason we worry about otitis media in children. Medications sometimes are not adequate to completely eliminate the infection. I'd like to point out how this problem develops. The normal ear drains through the eustachian tube. As long as the eustachian tube is draining and equalizing pressure of the blue arrows, the ear is happy. It hears well. It has no problem. It isn't collecting fluid. And everything is hunky-dory. But when this fluid collects and the eustachian tube does not equalize the pressures properly, you see that the blue arrows are disequal, unbalanced, and fluid collects. The eustachian tube is blocked, and the slightest germ can then infect that fluid. Other doctors may give the child antibiotics, in which case it's getting from an ear infection to the fluid state. It's not getting back to normal. This problem is therefore frustrating for a lot of people and a lot of parents because the fluid appears to constantly recur and never completely is eliminated. Medications are one thing that we use in order to help. There are several antibiotics, there are decongestants, there are nose sprays, in extreme cases even steroids. Steroids are not popular and remain controversial. The final option is surgery. Surgery on the ear is quite common today, particularly for ear fluid. It is the #1 surgery performed in the United States today is myrigotomy tube placement in children. The surgery is done usually under a general anesthetic in children under 10 years of age. The reason is many will not hold still. On most adults, the procedure can be done under local anesthesia in the office. When the surgery is performed, the doctor goes in and makes a small incision on the eardrum. The eardrum is numb at the time. In addition, you will notice that the nerves on the eardrum run like the spokes of a bicycle wheel. As long as the incision is made between two of the spokes, there is no pain. It's like a haircut. The tube can then be inserted. This is actual size of the tube. It looks like a tiny bobbin on your sewing machine. It is placed on the eardrum and fluid is allowed to come out. The pressures are allowed to re-equalize a different way. It is what we do to heal the chronic problems of serous otitis media and recurring ear infections. Many people have questions about the tubes. Does the child feel it? Generally, no. Generally, there is no pain associated with the tube because it's between the nerves of the eardrum. Occasionally, it will rattle until it seats into place, and the child may pull at his ear, wondering what it is rattling in the ear. However, be assured that there is no pain with this. Another precaution that we take is what I call a cardinal rule. We don't allow water in the ear, including shampoo and bath water. Ear protection is always required. Placement of earplugs, particularly in small children who are prone to dunking their head or splashing water, should always be used as a precaution. The ear tubes last about 12 months. It's a give or take proposition. It's not exactly to the day. If they do not come out at 12 months, we generally will have to return and remove the tube. Removing the tube is the exact reverse of putting it in. Usually a general anesthetic is again required, the tube is removed, and the hole in the eardrum is patched. Fortunately, only a minority of children have that problem. 80% of children and adults with ear tubes in will push them out on their own. And they generally will push out anytime from 8 to 12 months after they've been put in. This makes it quite easy to pluck the ear tube out from the ear canal when that process has occurred.